Cross has declared a national blood supply crisis after blood inventories dropped to just a one-day supply nationwide. Officials say the shortage could delay surgeries, cancer treatments, and emergency care if more people don't donate soon. And this is especially concerning in Virginia, where the Red Cross is the only blood provider for every health facility in the Commonwealth. And joining us now is Juan Garcia, Executive Director of the Red Cross of Northern Virginia. Juan, thanks so much for joining us. You know, I saw the headline and I knew that we just had to get the word out. What led to the blood supply dropping to this critical level?
So it's thank you for having us and for sharing this message. And it's could be a lot of variables here, but mainly also, if you think about summer, folks are relaxing, going to the beach with their families. Typically may not be a time that they're thinking about blood donation. Although what we'd like to recommend is that all year long is a good time to think about blood donation, as we can see from this crisis that has happened. And it's only the second time in American Red Cross history that we've ever declared a blood shortage crisis.
You know, just how serious is a one-day blood supply? We mentioned that off the top there. What does that mean for hospitals, for patients who depend on blood every day?
Yeah, so with the nation's blood dropping 25%, and American Red Cross provides 40% of the nation's blood, what it means is that we cannot give our best service to people in hospitals. So when people need blood transfusions for or have surgeries, or they have cancer treatments and they need blood, those items may be delayed or postponed, or doctors or hospitals have to make difficult decisions because of their blood supply. And we obviously don't want that to happen.
Right. You know, we hear that type O blood is especially important during this shortage. And for those who aren't familiar as to why type O is so critical, can you explain a little bit more about that? And also, of course, the other blood types that are in high demand right now?
Yeah, that is a great question. So type O is often the first blood used in emergencies because doctors may not have time to determine a patient's blood type. And the Red Cross has reported that the supply of type O positive blood has fallen below a one-day supply. What people don't know is that nearly half of Americans have type O blood, and that can make an immediate difference, whether it's type O positive or type O negative.
And Juan, I know you all say that just, you know, adding 3 more donors at each blood drive could make a significant difference. How can such a relatively small increase have such a big impact nationwide? Can you give us a little more sense on that?
For sure. When we think again about just the amount of people that have the capacity to donate blood, looking even regionally for ourselves, the Red Cross supplies blood products to about 60 hospitals in our region. And having people come and donate can really make that difference. I think the easiest way to do it is by going online, redcrossblood.org, or you could even call 1-800 Red Cross to make your appointment. Um, and people don't really realize the need for blood until, it happens to them or they're in the
Right.
hospital, and then they realize, wow, this is something that is very much needed.
And it is so easy. You mentioned the website. All you do is punch in your zip code and find a location and just follow the prompts. Juan, for someone who's never donated blood before or hasn't donated in years, what can they expect and who is eligible to give?
Yeah, the easiest way when you go online actually and you fill out our form and you take the health eligibility survey, what you do there is find information whether you're eligible to donate or not. And there's various factors there involved, like weight, some medical history. But what I like to tell people is that most likely you'll probably be eligible. And what I would like to say is that just come in with a relaxed attitude. Make sure you have a good full breakfast. This is a little bit different from when you go to the doctors to give blood, where sometimes you're doing tests and you have to go without eating anything. You have to fast. We want you to come in, with a good full meal, and come in to donate. And then after your donation, we try to make the experience as nice as possible for you. We have blankets, we have TV screens, and we even have snacks and
That's
some
the
juice
best
boxes
part.
after you prefer.
And Juan,
Yes.
and correct me if I'm wrong, is it about a pint that you all take?
Yes, yes, per person. Now, there are some other situations where you can donate more through Power Red. And just based on your eligibility, the best thing to do is talk to our health professionals that are at the location.
All right. 1-800 Red Cross, redcrossblood.org. Juan Garcia, Executive Director of the Red Cross of Northern Virginia, thank you so much for all that you're doing and for joining us.